Okay, so till now we have studied about the definition of posology, definition of homeopathic posology, and we have studied about the selection of potency. Okay, in selection of potency we have seen the factors, that is, first is the age, second is the sex, third is the habit and environment. Okay, fourth is the constitution and temperament. Okay, fifth is the nature of the disease. Okay, and sixth is the nature of medicine. Okay, or nature of doses what you are taking. Okay, these 6 points you have to remember. Okay, now we will go to the next part, that is various kinds of doses. Okay, like you have heard this dose was lethal to him, this was the maximum dose, this was the minimum dose. Okay, just we will elaborate these terminologies. Okay, what is the maximum dose, what is minimum dose, okay, what is lethal dose, okay, what is fatal dose, okay, fatal means death. Okay, so all these things, because these terminologies are important for the short notes. Sometimes what are the different types of doses, explain this, come as a long question also. Okay, just we will see all these things one by one. Okay, the first is the maximum dose. Okay, what is the maximum dose? It is the maximum or largest possible quantity of medicine not harmful to human life, which can be taken at a time by an individual. Okay, means maximum amount of dose that is not harmful to our body and that can be taken by an individual. Okay, at a particular time, that is called as a maximum dose. Okay, next, in homeopathic, maximum or large doses should not be administered to the treatment purpose except in cases of primary manifestation of psora, psychosis and syphilis. Here large doses always, as well as repeated doses of the indicated medicines are to be administered. Otherwise, the disease will not be cured, rather go on increasing along its courses. Okay, means psora, psychosis, syphilis. Okay, all these things are miasm you will study in organon of medicine. Okay, so with the psora, psychosis and syphilis, okay, these doses are related. Okay, means like suppose we have already talked, if disease is totally matching with the uh, drug symptoms or there is similarity, okay, then we can go for a maximum dose. Okay, that maximum dose you can give. You are properly diagnosed the miasm, okay, then at that time also you can give the maximum dose. Okay, so this maximum dose is the amount of dose that is the maximum for a particular individual at particular time. Okay, and that should give a positive effect. Okay, if it is started giving negative effect, then it is not the maximum dose. Okay, any doubt in maximum dose? Anything you want to ask? No doubt. Vishal,
Yes, sir.
Sneh Priya,
Yes, sir.
no
Yes, sir.
doubt na?
No, sir.
Okay, Sneh Priya, hello. Okay, next is the lethal or fatal dose. Okay, lethal dose or fatal dose. Okay, means lethal or fatal dose means name is suggesting it is harmful to our body. Okay, it is the also known as a toxicological or narcotic doses. It is such amount of the doses which can cause death on a living being. The fatal dose of different substances may be different with respect upon the toxicology. A fatal dose of a milder narcotic or a poison will obviously be more than that of the stronger uh, narcotic or poisons. Okay, means this fatal dose or lethal dose, okay, meaning is same. Okay, means it may cause harm to your body. Okay, that may be poison or that may be a narcotics. Okay, so these are called as a, okay, means actually these narcotics or poisons in very low doses. Okay, in very low doses they are also a medicine. Okay, but when just you increase the dose part, okay, then it may be a habit forming, okay, that is the narcotic, or that may be habit forming, or that may be a toxic, okay. Like simple example, we can take tobacco, okay. This tobacco, okay, in very small doses, these are the good medicines, okay. You have seen this is the vasoconstrictor, okay. In tribal places or the in villages, you have seen that they just put the powder of tobacco, okay, on the wound, so that it is a vasoconstrictor, and it presses the uh, this part, and blood flow is stopped, okay. But when it is taken in high amount, okay, it is because of its vasoconstriction activity, what will happen, it will just increase your blood pressure, okay. Severe headache, high bp, these are the problems, okay. That's why sometimes it causes heart attack, okay. That's why this may be lethal or fatal, okay. Means they are toxic, or they may be narcotics, okay. Any doubt? Sinolene, roll number 48. Any doubt?
No, sir.
Okay. Next, we will the minimum lethal doses. Okay, minimum lethal doses is the smallest doses that has been recorded and fatal to a healthy person, okay. Means any dose that is in minimum quantity recorded, okay. Like in second year you will start studying the toxicology, forensic medicine and toxicology, okay. There you will find paracetamol, okay. If you are any person is taking 4 gram of paracetamol, okay, then it is fatal, okay. Means it will cause the liver damage, okay. That is the problem, okay. So this is the very small quantity, okay. Means it is the minimum quantity from where the this will start, okay. Means harmful effect will start, okay. That is called as the minimum lethal dose, okay. Means minimum quantity of the dose that will cause harmful effect in the human body or the animals, that is called a lethal dose or fatal dose for that particular human being, animal, okay. Any doubt?
सर
बोलो।
सर होम्योपैथी में तो डाइल्यूट करते हैं, तो लीथल डोज का तो कोई चांस नहीं है।
जब एक क्रूड फॉर्म में होगा, when it will be in crude form, okay, at that time the
Other
problem
things
will be there, okay. Sometimes it happens, okay, actually there will be no lethal dose, okay, when we will do a potentization process, okay. But the problem is that suppose any person requires 30 potency and you are giving 1 m potency, then there may be homeopathic aggravation, okay. And because of this homeopathic aggravation, there may be so much pathological changes, okay. It will be irreversible, okay. Means suppose you have given 1 m or 10 m potency instead of 30 potency, okay. Now it has brought some particular changes in kidney, okay. Now that changes cannot be reversed, okay. After stopping medicine also you cannot reverse, okay, and the person will die, okay. So that may be a fatal dose, okay. Actually it comes in under homeopathic aggravation, okay. So
ओके
that is
सर।
the thing, okay. Means any person is only needing 30 C, okay, and you are giving 10 m potency at a time, or every day you are repeating, okay. So there any pathology will be occur that is not reversing back, means the person is not becoming healthy, okay. Then the problem will be there, okay. If the pathology will reverse, then there will be no problem. Like in cases of Dr. Hahnemann, okay, when he was taking cinchona of Snellis bark, okay. Okay, after he stopped, the pathology has reversed, okay, he was cured, okay, so it was okay. But if suppose he has taken for in high quantity for long time, okay, and the pathology was not reversed, okay, then the problem will be there, na? So like that, okay. So these are the just terminologies, you have to know these terminologies, okay. Means something will be used in homeopathy, some parts will not be used in homeopathy, okay. But in pharmaceutical field you have to know all these things, the minimum dose, maximum dose, lethal dose, okay, terminologies and what is their meanings, that you have to know, okay.
यस सर।
Next is the booster dose, okay. A subsequent doses given in the enhance the action of initial doses. Before this, where you have heard about this term booster dose? Remember?
वैक्सीन वैक्सीन
Vaccination, okay. When small childs, okay, they are just scheduled for the vaccination, okay. The pediatrician or the where they are taken, okay. There they are told to just to give the booster dose, initial dose, booster dose, like that, okay. These booster dose are like a means just you are giving and you are initiating the activity, okay. Like it is just you can in language of physics you can say you are just enhancing the threshold energy. Okay, this is called as a booster dose. Okay, any doubt in booster dose?
सर होम्योपैथी में नहीं है क्या?
Homeopathy booster dose, it is just like a complementary medicine sometimes. Okay, like supplementary or complementary medicine, you have just given one medicine. After that, if you are giving a proper follow-up medicine, okay, that follow-up medicine will help to just cure the disease. At that time you can tell it ki, haan, it is just helping. Okay, so it may be like a synonymous with a booster dose. Okay, but there is a no any means thing related with vaccinations. Okay, means we don't have vaccination process. Okay, we have to follow that government scheduled vaccination process. Okay,
Oh,
next is the booster dose. After that is the fractional or refractive or divided doses. Okay, means fractional dose, same thing, refractive doses or divided dose. It is the fraction of a full dose which is taken at a short interval. Okay, like, okay, I will again give you example. Okay, when you will study in second year forensic medicine and toxicology, there it is given. Okay, if 4 gram of paracetamol within 24 hours is fatal for a human being, normal human being. Okay, 4 gram. Okay, now how we take normally paracetamol? 500 milligram thrice a day. Okay, means 500, 500, 500. Okay, so it is 1.5 gram of we are taking. Okay, and what is the fatal dose? 4 gram of paracetamol within 24 hours. Okay, so we are just taking it in a divided dose. Okay, 500, 500, 500. Okay, so normal dose to just take care of fever. Okay, normal dose of the pain or fever. Okay, normal dose of paracetamol is 1.5 gram per day or within 24 hours. Okay, so that we are dividing in every 8 hours. Okay, 8 hour, every 8 hours, 500, 500, 500. Okay, so like that. Okay, if you have seen, okay, like your grandfathers or in your family members, they are taking any medicines. Okay, just that is in divided doses. Sometimes, okay, antibiotics or any other medicines. Okay, any blood pressures medicines or diabetic medicine, if they are taking, okay, that are in the fraction of divided doses. Okay, in morning, evening, afternoon, like that. Okay, so this is the actually the whole dose of whole day, 24 hours. Okay, next is the physiological doses. Okay, physiological doses are the those which stimulates the normal physiology or the function of a different organ or a system of our body, and hence the system thus appearing are known as the physiological symptoms. Okay, normal physiology. Okay, like when we are taking any material doses. Okay, like when we are taking our food, milk. Okay, balanced diet. Okay, just they are acting in our physiology. Normally we tell to our patients, okay, take good diet. Okay, take fruits so that your physiology will be enhanced. You take them like many others fruits. Okay, salads, so that your immunity will be good. So just they are acting in our physiological level. Okay, means they are just working on our the weaker part or our the organ system or the our whole body. Okay, but in homeopathy, normally homeopathic medicines, potentized homeopathic medicines, they works on the dynamic doses. Okay, in the form of dynamic doses. Okay, dynamic doses are normally works to just enhance our vital force so that we can just throw out the diseases or the any harmful, any part which is harmed, okay, by the disease or by the pathology or any other things. Okay, that is just taken out. Okay, so the physiological doses are those which stimulates the normal physiology or function of different organs or organ system. Okay, suppose you are not taking food for one day. Okay, for 24 hours, you will feel exhausted, weak. Okay, and you are not able to do anything because what food is giving you power for all the physiological activity, that is not there. Okay, your ATP is not formed. Okay, so these are called as a physiological doses. Okay, normally these things are in balanced diet. Okay, like we have to take this much of carbohydrate, this much of proteins, this much of fat, this much of vitamins, this much of fibers, roughage, water. Okay, so this is the physiological dose. Okay, next is the W.M. Boric. Okay, William Boric, in his a compendium of the principle of homeopathy, stated it is the physiological doses that is a dose large enough to produce symptoms. Opium constipates the bowel, produces quantity in the necessary not less than 1/2 to 1 grain. The constitute its physiological doses. Okay, like opium. Just Dr. William Borick has given one example. Okay, related with the opium. Opium. Okay, you have not seen the patients. Okay, later on, if you will see the patient with opium poisoning. Okay, so what happened normally if opium will act on your body, okay, like some persons who are in drug addict, okay, what happened, there is a constipation, okay, because of this, just there is a dryness of whole mucous membrane, okay, from mouth to anus, whole mucous membrane is dried up, okay, because of there is a dried up, and because of constipation, okay, the problem is there, okay. So this is the physiological action of crude form of opium, okay. And same thing, when this is potentized, it just act opposite, okay, means it acts on our constipation, and constipation is relieved, okay. So that's why it is important for you to know the, if anything is narcotics, anything is poisonous, at least you have to know the physiological activity or physiological sign and symptoms of that particular doses, because if it is in potentized form, it will help you to get rid of that problems, okay. Physiological dosage is sufficient quantity and strength of the drug to produce a definite uh, predetermined effect or a group of symptoms. Okay, means there may be many type of effect or many type of symptoms because of that physiological dosage. Okay, like suppose it is just an example. Okay, when you are taking every day, you are taking pomegranates. Okay, anar. Okay, what you like to feel. Okay, just your blood is increased, or you are just feeling somewhat healthy because you are getting the nutrients and minerals, okay. It beats these characters, okay. It is injurious to the patient, okay. It acts in a toxic nature, okay, in high doses, okay, physiological doses, they acts as a toxic nature. It action is the exact opposite of the curative action, okay. Means just we have talked about this, when you are taking any poison or any narcotic in a normal physiological doses, okay, they have just exact opposite action, okay. Means they are not acting properly, okay, just they are damaging our body part, or they are doing the harmful effect, okay. It is never employed in homeopathic practice for curative purpose, okay. Means physiological doses or the normal material doses of narcotics or the toxic materials are not recommended in homeopathy for the therapeutic purpose, okay. Then infinitesimal doses, okay, dictionary meaning of infinitesimal is the infinitesimal is small quantity and by extraction very small. The homeopaths are divided into two groups. For one, those which is immersible or inefficient through the remaining between the Avogadro's number. For the others, infinitesimal is beyond the Avogadro's number, is the spiritual dilutions, okay. Already we have discussed about this, okay. After 12 C potency, okay, there is no any material quantity, okay, as per the Avogadro's hypothesis, okay. So that is just the material is not there, but the energy is there, okay. So this type of doses are also there, okay. Then average dose is there, okay. It is the prescriptions adjusted doses according to the requirement of the patients, okay. Then single dose, okay, it means that only one dose should be given in a day, okay. Means in 24 hours you are just giving one time, okay. That is called as a single dose, okay. Then daily dose, okay, it is the total amount that can be given in a day, either as a single dose or in total amount divided of 3 or 4 doses, okay. That is called as a divided dose, okay. Total doses, it means that the total amount to be given in a day which should not be expected, okay. Then minimum dose, what is the definition of minimum dose, okay. It is that dose which is sufficient to overpower and enact the disease and capable of producing slight homeopathic aggravation, can be absorbed after the ingestion, okay. Section 280, okay, in aphorism number 280 it is given, okay. Minimum dose is that quantity or that amount of dose, okay, that is given to a patient and which helps to stimulate the vital force, so that there will be a temporary medicinal disease will be there that will overpower the the disease that is because of any pathology or because of materia precans, okay, and it overpowers and it clears the problem later on. Okay, so the minimum dose is the, or that dose that just stimulate your threshold energy, or that stimulates your vital force. Okay, it is that amount of medicine which through smallest quantity in a smallest in quantity produces the least possible excitation of the vital force and yet sufficient to effect the necessary changes. Okay, it is given in aphorism number or section 246. Okay, it bears these characteristics. It is beneficial to the patient. It is curative to the action. It is not toxic in nature. Its action has been proved. Okay, means always try to give minimum dose because it will not be harmful to the patient. Okay, it will be helpful to the patient. Okay, and it will not do any type of homeopathic aggravation. Okay, that's why the minimum recommended doses is important, and that only comes from the clinical practice. Okay, means it is long clinical practice you can understand, or by the help of the books written by the different stalwarts or the different practitioners who are practicing from long time. Okay, by them you can understand the quantity of minimum dose for particular patient. Okay, Nace has defined a minimum dosage as it is a dose, crude or potential, capable of affecting the patient curatively without unnecessary aggravation when given according to the law of similitude. Okay, means Dr. Mace has told that minimum dose is that amount of dose that when you are giving it just bringing a curative effect. Okay, without just doing any type of homeopathic aggravation. Okay, then after that we will see the evolution of concept of minimum doses. Okay, evolution of concept of minimum dose was, it was just means time to time it was changing. Okay, like Dr. Henneman has started with the crude doses, then he started with the decimal scales, then he started with the centesimal scale, then he started with the LM potency. Okay, so the quantity of minimum dose was time to time he has changed. Okay, reason behind the application of minimum dose. Okay, because already we have discussed when we were discussing about the different types of potencies. Okay, key like minimum dose, advantage of minimum dose was there was no any type of homeopathic aggravations. Okay, and this type of highly diluted minimum dose, okay, or maximum potencies, LM potency, centesimal potency, they are good for the chronic diseases. Okay, then advantages of minimum dose already we have discussed. Okay, then repetition of the doses. Okay, when you will repeat the doses, okay, that is a that is like a challenge. Okay, for the physicians. Okay, when to repeat dose, when to give placebo. Okay, and when to just observe the patient. Okay, means this repetition of dose or second prescription, that part is very much important. Okay, that needs your logic, reasoning, and your proper understanding of the disease. Okay, and the curative effect, how the patient is curing. Okay, when you have to just give the placebo, when you have to increase the medicine at same potency, and when you have to give medicine in the low potencies. Okay, like that. Factors responsible of the repetition of dose. Okay, like different, just author has given the views. Okay, like the constitution and progressing of the patient, nature of the disease and nature of the remedy. Okay, means normally which type of progress of the disease or cure is there, which type of remedy you are using, and which type of disease is there. According to that you can just do the repetition of the doses. Okay, then nature of the disease is there. Okay, then single medicines are there. Okay, okay, so this much is done. Okay, so what we have discussed in posology we have discussed about the definition of posology, definition of homeopathic posology, then selection of potency. Okay, selection of potency contents like age of the patient, sex of the patient. Okay, then constitution of the temperament, habitat and environment. Okay, then there is the nature of the disease and nature of medicine what you are giving to your patient. Okay, then different type of doses are there. Okay, like maximum dose, minimum dose, lethal dose. Okay, then poisonous dose is there. Okay, then there is like a minimum dose. Okay, the minimum dose is like that ki what is the minimum quantity of dose you are giving to your patient. Okay, so till here any doubt you have? कुछ डाउट है यहाँ तक?
सर
बोलो.
सर लीथल और पॉइजनस डोज में डिफरेंशिएट करके बता दीजिए ना एक बार.
Okay, lethal dose is like when you are taking the dose and the death will occur. Okay, lethal dose, okay, means death will occur. Okay, poisonous means it will poison. Okay, it will poison any part of body or any organ of the body. Okay, but it may be recovered after hospitalization or after you are giving antidote. Okay, but lethal means death will occur. Okay, always the lethal dose is more than the harmful or the harmful dose. Okay, means toxic dose anything, okay, which suppose anything will cause you diarrhea, that is also a harmful effect. Okay, but
Yes, sir.
anything will suddenly cause death, that is the lethal dose. Okay, means harmful dose is like you are taking, you are getting slight altered of action on your body. Okay, so that is the means there is a possibility of living, you can live. Okay, but if like lethal dose your person is taken, then there is chances of living is like very less. Okay, that is called as a lethal dose. Okay, like suppose I just given before that example of paracetamol. Okay, every day 1.5 gram. Okay, suppose any person is taking 3 gram of paracetamol. Okay, harmful effect will be there, the person will not die. Okay, but if the person will take 4 gram of paracetamol or more, the person may die. Okay, that the harmful effect is different, and lethal is like it is certainty of death. Okay,
Yes, sir.
anything else और कुछ?
सर मैक्सिमम डोज भी तो लीथल हो सकता है ना कभी कभी.
Maximum dose, actually maximum dose may be lethal. Okay, maybe not lethal, may be like poisonous. Okay, because it comes after a long clinical experience. Okay, maximum dose only when you are giving the maximum dose, when you are totally certain with the disease and the drug. Okay, law of similia similibus curenter. Okay, if disease is totally matching with the drug symptoms, okay, means all matches are there, then and then only you are giving the maximum dose. Okay, means that will stimulate the threshold energy. Okay, but because of unexperienced physician or because of the fault of physician, it may happen that may be a like a harmful effect or lethal. Okay, that may be, but like it is very less. Okay, means occasionally. Okay, occasionally it may happen. Okay, it is not like that it may always be happening. Okay, but like in some material dose, okay, any person is taking a material dose. Okay, so already that all the doses were already studied. Okay, suppose anything was taken from above this dose, it is lethal. Okay, nobody tell you to take nux vomica in crude form. Why? Because of that, nux vomica is poisonous. Already it is studied. Okay, already literatures are there. Okay, everyone will tell you to take nux vomica in very low potency or like high potency or in the centesimal potency. Okay, even mother tinctures are not recommended in high quantity. Okay, because they are poisonous. Okay, in crude form they are poisonous. Okay, anything else और कुछ क्वेश्चन है और कुछ पूछना है इस चैप्टर में? जाह्नवी,
सर
कुछ है क्वेश्चन पूछना है?
नो सर.